Doctors, nurses of Reddit, what is the most obvious case of a patient faking it you have ever seen? Back when I worked IMS and before I worked in the hospital, we had a little more freedom on how we would assess if people were faking. I had a guy that was pretending to be unconscious. Conveniently, I was orienting a newly hired EMT. I explained to the new EMT if this guy was unconscious his arm wouldn't move from where we placed it. I lifted his arm straight up in the air and he held it extended there for the entire 30-minute transport to the hospital. I was actually impressed he was that committed. I finally had to lower it to unload him from the back of the ambulance. Faking being unconscious while peeking. Hard sternal rub. Presto. No longer unconscious. And very angry. My dad is a paramedic, and if the obviously faking patient somehow makes it through the sternal rub and the arm drop, he asks his partner to hand him the ocular needle, where his partner chimes in and says incredulously the one that goes in the eyeball. Every time they miraculously come to. Had a patient complaining and passing. We heard them go plink in the bowl. Bladder stones. Meds galore. Of course. Those things hurt. We sent the stones for testing. Turned out the joke was on us. They came back as gravel. Even the lab said not usually found in human anatomy. No more Drew Gus for you, lady. Took me a while of wondering how she got gravel in her bladder to realize that she was just dropping them into the bowl by hand to make the sound. Lol. A patient who came in with seizures. It was questionable. Began to have one when the doctor was in the room, but noticed the patient's movement slow and they opened one eye a teeny bit to look at him and make sure he was watching and then resumed shaking. Discharged after basic workup. ER nurse here. So many people fake seizures in our waiting room in hopes of getting a room quicker. Most recently funny one, I had a family member run over in a panic yelling, "He's having a seizure." I hopped out of my chair and took a couple quick steps only to witness a full-grown man leaning against a wall, shaking in a way that can only be described as a terribly uncoordinated dance move whilst peeking at me to see if I looked worried as he shook his head back and forth. I stopped in my tracks and said he'll see a doctor soon with the most energy I could muster and retreated to my other tasks in exasperation. Not a doctor, but when I was younger I wanted glasses really badly, so I kept telling my mom I couldn't see. She took me to the optometrist and she did the usual letter bullshit. And then put a picture of an orange on the screen. I told her I saw a banana. Obstetrics here. We had a 27-week pregnant girl come in claiming her waters had broken and she was in preterm labor. Tested with a dipstick, not positive for amniotic fluid, but she was in our HDU just in case. She went to the loo and came out with a soaking pad and tried the "my waters just broke" thing again. Yes, she'd run it under the tap. Then we had a lovely chat about how amniotic fluid and water do not smell at all alike, and she stopped doing it for a couple of weeks and started faking PV bleeds by putting lipstick on her pads instead. Not me, but a fellow nurse used to work in the ER in Albuquerque. Had a lady come in with severe pain from her varicose veins seeking opiates. He washed the red marker lines off part of her leg and told her to leave. Former EMT here. We had a patient who had a plethora of actual problems, but she would fake having seizures in order to get into the ER. I had heard dozens of ridiculous stories about this patient. So when I finally got called to her house for the first time, I was actually a little excited to see what she was all about. When we got there, I began setting up EKG leads and getting vitals from her while my partner was getting the stretcher out. My partner yells from the truck, "Hey, be careful. Sometimes she likes to fall out of her seat when she has seizures." No more than a second after he says this, our patient just so happens to tip right out of her seat. I swear I almost saw her smile as she did it. I have had patients fake seizures to try and get admitted. They are usually careful to make sure everyone is watching before thrashing around on the stretcher. If you turn around, sometimes they stop and then will carefully peek to see if you are paying attention. After the reports of people peeking while faking seizures and unconsciousness in this thread, I'm pretty convinced no one ever mentally grows up past the age of 7. I worked in a pain management clinic. It can be hard to diagnose and measure pain. But about 10% of the patients were clearly, unquestionably addicted to the meds. They all shared an attitude of duck with my meds and I will cut your face. Anyone who said that the pain was 11 billion/10 was also immediately suspicious. Having a seizure while doing the worm on the ground and telling me that only Dilaudid ever stops these. Yeah. Narcotics don't break seizures. You have no idea what a seizure looks like. And you can't talk while having a tonic-clonic seizure. Nobody's buying your sheet. Maybe not the most obvious in conventional terms, but perhaps the funniest story involving faking it from my work in prison healthcare. Every morning the prisoners get a chance to move, mostly, freely around the prison to go to their workplaces. Or visits or healthcare if they are on daily meds, etc. Often if people are unwell they will come to healthcare and get a sick note so they can get a day off work without being penalized. Well, one day about 30-40 lads turn up at our healthcare window complaining of headaches, stomach aches. A few claiming to have vomited, although no confirmation from any of the officers. The really weird part was that every single one of them was from the same prison wing. We put in a security report worried something fishy was going on. Turned out that one of the guys on that wing had family appearing on the Jeremy Kyle show, UK's version of Jerry Springer, and all the guys wanted to stay in their cells and watch it. I've seen some great ones. I was rushed to a room after being told a patient was having a seizure. I went in and she was thrusting her hips up in the air along with obviously fake arm leg shakes. I just stood there watching and she turned her head to look right at me while convulsing. Suddenly it stopped and I could see her trying to spit out the corner of her mouth. I asked what was that about, to which she very quietly answered, "I just had a seizure." I told her I was glad it was over and left. Might post more later. As a radiographer, my favorite is always the kids who are trying to milk some extra time off school. They'll come in with their helicopter parent flinching and sometimes crying as you move their arm into the required positions for the x-rays. Then use the affected arm to push themselves up out of the chair when they leave. Or if it's an ankle, they'll enter the x-ray room cringing and not putting it on the floor. Then we'll jump off the x-ray table. Nice try, kids. No plaster for you. I had a patient who kept complaining of 10/10 abdominal pain, who insisted it was her gallbladder and that Tylenol wasn't going to help. However, every time somebody saw her she was eating a hamburger or something. My pain level is definitely a 10. Are you sure? You just spent 15 minutes exchanging jokes with that person over there. You don't seem to experiencing level 10 pain. Comedy is how I get through the pain. Give me my meds. Patient was a man with a fistula with copious output, created by himself by picking at an incision site. He had a controlled substance alert. Was continuing to request his oxy every 4 hours on the dot, which I gave BC. Abdominal wounds are painful. And also requesting IV Dilaudid. When I told him that I wasn't going to be giving him the IV Dilaudid, he was very upset and tried to manipulate me into changing my mind. But I didn't cave. Later I enter into the room to see him happily picking at and extruding his own bowels. The ostomy bag that was catching the output was completed, filled with blood. The first thing he requests when I enter was the IV Dilaudid. Probably one of the grossest things I've seen in the hospital. Also, you get a lot of requests to push the IV Dilaudid quickly. Oh no. Really? All the other nurses do it that way and always commenting about what a waste of time it is to push it slowly. I've seen patients faking seizures, but not like this guy. Arms and legs shaking. Not the head or torso. Looked more like a rain dance than a seizure. Talking through it. Neurodoc happens to be close by and comes in the room when we call for him. "Stop that," he says. "I can't." Patient replies. Doc puts his hands on the patient's legs, hard and firm, and says stop. Patient stops. She thought she had a stroke and was completely paralyzed on her left side. But that was obviously not the case, as she periodically used her left hand to wipe her eyes. She was crying so hard she didn't even realize she was doing it. and continued to think she was paralyzed. I thought she was faking it at first, but it turns out the patient had conversion disorder, which means they thought they had a physical medical condition, and they were manifesting symptoms of one, but they actually didn't have it, and their brain was tricking them into thinking it. In essence, they weren't faking it, but they also weren't physically sick. Formal and nurse here. Watching someone try to fake labor is quite funny. They will push on the contraction monitor to try and make it look like they are having contractions, but they look like squares, not hills like normal contractions. They never have them if you're in the room watching. Or they scream and holler while pushing on it. You can't fake labor. Student midwife here. We get pregnant ladies who come in and claim to have had a bleed to get a free scan. Ask them to put in a new pad. No blood appears. Often saunter in completely casually, and the moment the scanner goes on, get their friend to take photos of the screen. What they fail to remember is because they just couldn't wait to see their baby. The woman who actually had a bleed and is scared witless is going to be waiting even longer, while faking it lady is going to be asking what the gender is. The other lady is just going to be begging them to tell her there's a heartbeat. As someone who has exaggerated in a doctor's office, I know the other side of this. When going in for evaluation, I was told not to take any of my pain meds for a couple days before the appointment, so that the evaluator could get an accurate idea of how bad my condition actually was, and still is. On bad days, even heavy pain meds barely take the edge off. On good days, I don't need pain meds at all, and can live almost normally. Well, evaluation day was a good day. The evaluator saw a bad day. If she hadn't, I would not have adequate resources to manage day to day. Sometimes you have to play the system to get what you really need. I doubt this will get much attention at this point, but here goes. There was a patient who was in a wheelchair and reported having a spine injury that caused her to be paraplegic. She wanted a note to get disability. When the attending asked for her paperwork, she stood up out of the wheelchair, walked over to her backpack, got out the paperwork, and then sat back down. The look on all the medical professionals in the room was priceless. Just popping in to mention that while patients do fake it, and it happens with some regularity, especially in emergency rooms, I've encountered nurses in those areas who are convinced anyone without an obvious external injury is faking it. And that's just too broad a brush by a mile. To the point I've had nurses fail to pass patients' complaints of pain in a timely manner forward to me or others on the team. And in a few cases I've had a nurse walk up and expound on how much she thinks X patient is just there for Drew Gus when I just looked at imaging or some other finding that would cause significant pain in just about anyone. Unquestionably, lots of people fake pain to get pain meds. This doesn't mean that everyone is faking, or that known past fakers should be instantly assumed to be faking this time. That's a good way to watch someone die in agony. I'm a vet, so I don't know if this counts, but one time an old school friend who I kept in touch with swung by and paid me to patch up a pretty bad cut on his chest. I knew they were up to something bad that had led to this obvious knife wound, but they said they were out camping hunting and that they were drunk and didn't really remember. I helped as best I could with the stitches and only ever saw him one time after that, buying a bagel from a food truck, but hey, $20 is $20. 20 years ago I was completing my EMT certification, and as part of the process I had to spend a couple of nights working as a general purpose gopher and assistant in an emergency room. Around 2 AM one evening a guy was brought in. Suspected drug overdose. Apparently he was a frequent and regular customer, and the nurses were clearly irritated that he was back. They were even more irritated that he was unconscious, because several were convinced that he was faking it. This grizzled old battle axe said, "I'll find out if he's faking it," and told me to come give her a hand. I stood there and watched in stunned silence as that nurse chuckled and shoved a catheter up that poor bastard's big dick that was roughly the same size and diameter as a garden hose. I wanted to crawl under the furniture, but she didn't flinch and neither did he. So it was concluded that he probably wasn't faking it this time. I've been slightly terrified of nurses ever since. Patient played possum and pretended not to be able to talk. move, etc. And did a pretty good job of sticking to the act. Until the Foley cath. The patient was then not only able to move around. The patient was also able to scream FCK very loudly. Obviously nothing was wrong with them. They just wanted a place to stay. Not me, but my father is a PA and once administered a urine test to a suspected drug user. The patient returned a jar filled with a completely clear, lukewarm liquid which my dad instantly suspected was water. He ran a few tests and it had a pH of 7, or very close, and a density of exactly 1.0 gcm3. The patient had to retake the urine test. Paramedic here. Got sent to a car accident between a pedestrian and a car, a really BS one. The car scratched him at best, it was like 4 km/h. PT kept telling us that the other driver broke his leg. Complaining about 10/10 pain in his leg, telling us that this is the worst pain he had ever felt, no pain can ever be as painful. Dude didn't even had a scratch on him. Going through a bumpy road, a thing that usually is a nightmare for people with broken limbs, hell, for any kind of pain in the limbs. And yet, not a word from him, didn't faze him a tad bit. Told the doctors at the ER that the only thing that's hurting him is his insurance.